Hello everyone and welcome to today's video. We're going to be looking at this question today and going through the steps that we need to follow in order to solve this question. So the first thing I'm going to do when I look at a question like this is read the final line. So that gives me an indication of what to look for in the stem when I go through it. So this final line says, which of the following will most likely decrease the murmur's intensity? Right off the bat, this has given me some important information. So this has told me that this is probably a cardiology question, and it has told me that I want to look for clues about a murmur, right? So let's go back and start reading the question. So it says a 25-year-old male runner collapses and dies during a race. Now, already we have some very important information. This right here, 25-year-old, this age can give us a lot of clues. So I'm going to just underline that right there. Then it says runner, right? Runner. This patient is an athlete. So this can be an important clue. So this patient collapses and dies during a race. A photomicrograph of a section of myocardium obtained at autopsy is shown. So we have this histology image here, looking at the myocytes and their orientation. That can give us some clues as well. At screening, his 22-year-old brother is found to have a murmur. Now, a quick little piece of advice here is that always try to think from the perspective of the test maker, right? Whoever made this question didn't just put this in here, this brother thing in here for no reason. The fact that it's mentioning a brother who is found to have a murmur and you have this patient collapsing and dying during a race probably means that there is some kind of heritability or some kind of genetic factor involved somewhere here. Which of the following will most likely decrease the murmur's intensity? So now we have some clues, right? What are our clues? Yes, so our clues are that we have a sudden cardiac death in a young athlete. What else? We also have the clue of this piece of histology. Now, if we look at this closely, normally when you look at myocytes, they seem to be arranged parallel to each other. You can Google an image of normal myocytes. But here you see that they seem to be going in all sorts of different directions. This disordered arrangement of myocytes is known as myofibrillar disarray. This is our second clue. So this is our first clue, sudden cardiac death in a young athlete, and our second clue is myofibrillar disarray. Our third clue is that there seems to be some sort of genetic component to the condition that we're looking at. So let's take a look at what these clues lead us to. Based on these three things, right? Based on these three things, a sudden cardiac death in a young athlete, myofibrillar disarray, and the fact that there is a genetic component involved, we can safely deduce that this is probably hypertrophic obstructive cardiomyopathy. Hypertrophic obstructive cardiomyopathy is the most common cause of sudden cardiac death in young athletes. It presents with myofibrillar disarray, and it has a genetic component. It is inherited in an autosomal dominant fashion. Okay, so it has autosomal dominant inheritance. Now, all of these things give us the diagnosis, but that's not all that the question is asking. If you look at the question specifically, the question seems to be asking which of the following, meaning these options, will most likely decrease the murmur's intensity. So before we even look at the options, let's go ahead and look at why there is even a murmur in the first place in hypertrophic obstructive cardiomyopathy. So let's look at why there is even a murmur. So what happens is, in hypertrophic obstructive cardiomyopathy, you have a hypertrophied septum. So the interventricular septum is hypertrophied. This hypertrophying of the septum leads to an outflow obstruction. So because your interventricular septum is hypertrophied, that impedes the blood flow out of the heart. From the left ventricle out of the heart into the aorta, that blood flow is obstructed. So what happens if there is a obstruction? Well, that leads to a murmur. And what are some key characteristics of this murmur? Because this is pretty high yield. This is a high-pitched murmur. It is mid-systolic. It is crescendo, decrescendo. And it is at the left lower sternal border. So now we know why there is a murmur. Based on this knowledge, we can now go ahead and take a look at thinking about what would decrease this murmur, since that's what the question was asking. Well, the reason we had the murmur was that there was a hypertrophied interventricular septum. That means that we need to get that septum out of the way. So in order to get the septum out of the way, we need to stretch the ventricles. How are we going to stretch the ventricles? We're going to stretch the ventricles, working backwards, by increasing preload. Because if we increase the amount of blood that's filling up the heart, the end diastolic volume in the left ventricle, also known as the left ventricular end diastolic volume, that will stretch out the heart. And when it's stretched out, that moves that hypertrophied septum out of the way and decreases your outflow obstruction, thereby decreasing the murmur. So now let's go through the options and take a look at what will do that. So the first option is nitroglycerin. What's going to happen if we administer nitroglycerin to this patient? There's going to be venodilation. If you remember, nitroglycerin causes venodilation. If there's venodilation, the veins are dilated. Remember, the veins are what fill into the heart. So that's going to decrease the preload, therefore decreasing the stretch. It's going to decrease the stretch because there's less blood filling up the heart, and therefore that will increase the murmur. So that can't be the right option. So what's next? Our next option is the passive leg raise. What's going to happen with passive leg raise? Well, when you suddenly raise your legs, gravity is now on your side and you're going to increase venous return to the heart. If you increase venous return, you're essentially increasing preload, therefore increasing the stretch. If you're increasing the stretch, you're moving the septum out of the way and you're decreasing the murmur. So we have our correct answer. It is the passive leg raise. But I recommend when you're going through questions to always also go through the incorrect answers, even if you find the right one, so that you can be prepared for any future questions they may ask you, where that information may have been relevant. So the next option was dobutamine. Let's go through why it wouldn't be dobutamine. Now, dobutamine is a positive inotrope. So what does that mean? That means it's going to increase the force of contraction. When there's increased force of contraction, that leads to something known as systolic anterior motion of the mitral valve. So the valve actually moves anteriorly during systole, and it can cause an outflow obstruction. It will increase outflow obstruction. Therefore, increasing the murmur. What's the next option? Abrupt standing. Why is this wrong? What happens when you abruptly stand up? Well, it's essentially the opposite of what was going on with the passive leg raise. With the passive leg raise, gravity was helping you push the blood into the heart. Now, You're opposing gravity, right? So this will decrease venous return, thereby decreasing preload and decreasing the stretch and intensifying the murmur. The final option was Valsalva. This is an interesting one. Why is Valsalva not the answer? With the Valsalva maneuver, you increase your intrathoracic pressure, thereby decreasing preload. Why? Because this intrathoracic pressure means that your heart isn't able to expand as much and fill up with blood. And this leads to an increased murmur. And there you have it.